welcome to the Green Table Talk, where we will have open and honest discussion about transplant. I'm your host, Jennen Johnson. Today we have two nutritionists. One, her name is Christine Nash, who, by the way, helped me out during my kidney transplant journey, and another amazing nutritionist by the name of Linda Cerlleo. Ladies, welcome to the show. Thank you for joining us.
Thank you.
So first off, introduce yourself. Give me a little bit of a background for yourself. Linda, let's go with you first.
So hi everyone, my name is Linda Cerlleo. I've been a dietitian with the University Health Network for over 15 years right now. I have been a renal dietitian within that time frame as well. My main focus was kidney transplant patients and patients who are on hemodialysis. Within those 15 years, I was actually graduated through an internship at the University Health Network and have been there ever since. I have developed a passion for patients with kidney disease and trying to see how to optimize their nutrition in order to make them more successful post-transplant. So my role has given me the best of both worlds in terms of seeing how a kidney can decline, its function can decline, how nutrition plays an important role in that aspect. And then after they receive a kidney transplant, being able to say, okay, these are the wonderful benefits of now having a transplant, being able to liberalize your diet and being able to have a more flexible lifestyle. So that's my main goal in terms of being a renal dietitian.
Beautiful. Thank you very much for your help, by the way. On behalf of everyone that was much like myself who went through this process, thank you.
You're welcome.
And Christine, let me hear a little bit about yourself.
Sure. I'm also a registered dietitian. I'm also a certified diabetes educator, also at the University Health Network's Toronto General Hospital, where I've been a colleague with Linda for many years. I've been working with chronic kidney disease, patients with chronic kidney disease for over 15 years now. I look after patients on dialysis, both hemodialysis and peritoneal dialysis, as well as some in stages 3 to 5. And so like Linda, I'm very passionate about renal nutrition. And I feel that, patients have so much that they deal with and have to juggle and balance in their life when they have kidney disease. And so if I can make the diet a little bit more manageable and more enjoyable, that's kind of my goal. Nationally, I co-chair our Canadian Association of Nephrology Dietitians, and I also sit on the province, the Ontario Renal Network as the provincial renal dietitian lead. And so, it's been really great connecting. We connect with patients on a regular basis, try and really improve our education, resources for patients. We work with patients to get feedback, what we can do better. And yeah, I'm really excited to be a renal dietitian. I just love my job. I love coming to work and working with Linda as well. I think we're a good team. We try and tackle the challenges with our patients.
Beautiful. And you're also my renal dietitian as well. And you did a great job as well. And thank you very much, both of you, for being on the show. So my first question I'm going to pose to Linda. What would you say is the top 3 nutritional recommendations you'll provide to someone who was just recently diagnosed with kidney failure?
For the top 3 nutrition recommendations, it would all depend on the stages of kidney disease. As we know, as some of you may be aware, there are different stages of kidney disease. And depending on the stage, your nutrition does change. But if you have to suggest like the top 3 of someone who's newly diagnosed, I would probably say low sodium, low potassium, and low protein. In terms of trying to elaborate further on one of those aspects, low protein becomes crucial in terms of trying to preserve kidney function as much as possible. So these are for individuals where kidneys are the stage of kidney disease is not stage 5 yet, where they need dialysis. So patients that we need to help preserve their kidney function as much as possible, we would recommend a lower protein type of diet. For low sodium, it would be recommended to help control blood pressure. So following something like a low salt diet will enable a person to help control their blood pressure, and also some swelling that may occur as kidney function starts to decline. And then the other one would be potassium. That would probably, Not all individuals who are newly diagnosed need to follow a potassium restriction. However, that's one of the key nutrients that we would look at. Potassium helps the heart and muscles function properly. As kidney function begins to decline, you have a decrease in, so you might have an increase in potassium in your blood, and therefore what tends to happen as a result, you could develop certain like heart palpitations, or even worse, a heart attack. So potassium becomes a huge nutrient to look out for.
Okay. So if you are recommended by your doctor to do one of these three things, you definitely should do it, because it literally is, your life is in your hands literally by doing these things. Is what I'm getting from saying. Gotcha.
Exactly.
Christine,
Yes.
talk to me about plant-based renal diets. Is that something that everybody who's been diagnosed with kidney failure, that they have to go on automatically, or how does that work?
It's a really good question. It's actually a very hot topic right now. There's a lot of interest in the plant-based diets. And so we actually had some recent guidelines come out in 2020 for nutrition. They were updated after 10 years, and we were eager to see what the recommendations were. And actually what they had recommended was that, at this time, there's just not enough evidence to suggest that one protein type is better than the other. But in saying that, when you look at the studies, there's just not a lot of studies done at this point in time. So I'm interested and eager to see what the future holds. I think certainly, a plant-based diet can be incorporated into somebody with chronic kidney disease. I think it's got a lot of benefits. Obviously you get the impact of extra fiber. It's low in fat. It's just good to have that variety in there. So one thing that you want to also keep in mind, though, is with plant-based proteins, for example, the legumes, they do pack a punch in terms of potassium load. And so, you really have to be careful with, well, I shouldn't say all patients, but some patients have to be careful with how much and how often they incorporate in their diet. And so that's what we typically will do as renal dietitians, is we look at what the patients really want. So I think that's the number one focus, is what do patients like? Do they like plant protein? Do they prefer the animal protein? Do they want a mix of both? And from there, you take their preferences, and if they do want to incorporate some plant protein, you can do that. You just have to be very strategic about it, and you can weave that nicely into their diet. There is some talk too with it potentially being a little bit, of a benefit in terms of overall phosphorus levels, just because with plant protein, it doesn't have the same absorption rate as the animal protein. So you're not actually absorbing, your body doesn't have the same ability to absorb the phosphorus from the plant protein as it does with the animal protein. So you're actually getting less phosphorus absorbed into your bloodstream and into your body. So phosphorus isn't as much of an issue. But again, there's just not a lot of studies that can throw a lot of weight behind whether or not, you should actually put all your patients on a plant-based diet. But it's certainly getting interest, and the studies are looking promising. So we just have to kind of wait and see what the bigger studies show us.
That's good to know. Linda, what would you say would be some kidney-friendly foods? Someone who was just recently diagnosed with kidney failure, what type of kidney-friendly foods would you recommend?
So again, it will kind of depend on their blood work and the stages of kidney disease. So as renal dietitian, we do tend to look at blood work, and we tend to see what stage of kidney disease and types of foods that you may like or enjoy more often, and how we can incorporate those into your diet. So it's not to say that you're not able to have these foods ever again, but we're able to say it's a bit of a negotiation pattern in terms of what foods you can have and what foods we can try to have perhaps a little less often. But saying that, you look at all the different nutrients that are part of the kidney-friendly diet. So for example, the potassium that I was discussing previously, there's lots of fruits and vegetables that are considered lower potassium, a lot of the green leafy vegetables, zucchini, for example, cucumbers, types of things that you potentially can incorporate into your diet. Also, some of lower potassium foods tend to be things like white breads, white cereals, and things that are more white type grains and things like that. However, we do tend to sometimes incorporate whole grains into the diet, depending on your blood values as well, especially for patients who have other comorbidities such as diabetes, for example. We would like to incorporate the fiber as much as possible in order to see and knowing the benefits of fiber in terms of other comorbidities such as diabetes or cholesterol. So we're able to add those things back in. In terms of other foods such as phosphorus, looking at things that are a bit more homemade perhaps versus processed foods, because a lot of the processed foods tend to have a lot more phosphorus in them. So trying to work with the patient in terms of ways to perhaps making foods at home and what that will kind of look like for patients, and looking at things like dairy products that tend to be a bit higher in phosphorus, but looking at other alternatives. So perhaps unenriched almond milk, for example. These would be some others, or if someone really likes ice cream, you can look at sherbet or sorbet. So some of these things could be added back in. Again, looking at their blood values. Other things in terms of sodium, for example, we'd be looking at in the earlier stages, you would want to choose a lower salt diet. So start to have that lower salt diet. It does take about 6 to 8 weeks for your taste buds to change. So to notice that, so typically I tell patients, don't go home and say, okay, no more salt. I'm not having salt anymore. This is not happening, because what's going to happen is the next day, you're just going to crave the potato chips, for example. So
I'm a victim of that, by the way. I know exactly what you're talking about.
So sometimes what tends to happen is that we just tell patients to slowly start decreasing the amount of salt in your diet. Perhaps you can look at things like food labels and looking at things with no added salt, adding some more spices or herbs, looking at things like homemade foods versus processed foods. So these types are options, or using fresh herbs or special spices more often. These types of things would be a bit more beneficial in terms of lowering your salt diet, because it does take a little longer time to follow that salt restriction.
Okay. Yeah.
Can I just...
Sorry,
Linda, I just wanted to add in, Linda, really quickly with the salt about the 6 to 8 weeks. I think it's really amazing, and I'm sure you see this as well, is when, you know, your patients are working really hard to get their salt down, and they've been maintaining a low salt diet for some time. You know, I'm talking months and months and even years. It's amazing to me when they will, for example, say, we're going to go out for, you know, a special dinner and it's takeout, you know, is that okay? And, you know, of course it is. You balance that out and it's a special time. And, you know, the next day when I see them, I say, how was the dinner? And a lot of times they'll say, it was so salty. It was, you know, I didn't even ask for salt and it was so salty. And I'm so proud of them, because it means they are following a really low salt diet, because their taste buds have adjusted, and they actually have such higher acuity of recognizing the taste of salt than you or I, you know, Linda and I should say. So, you know, it's a really neat thing to see that, you know, they've reduced it so much that their taste buds have actually adjusted, and they can pick out the salt better than any of us.
For sure.
It's true. Because to this day, I still don't use a lot of salt in my foods. Like, you know, if I'm cooking a little simple here and there, but since that whole, you know, the whole renal failure, I just don't. Like you said, every time I go somewhere, if I'm, you know, I go to my mom's house and I'm eating her food, it's like, oh my gosh, there's so much salt in this. Like you can smell it, you know? So it's,
but they don't notice it, right? They don't notice that it's salty. So it's kudos to the hard work of the patients when they do notice that.
Exactly.
Christine, let me ask you about exercise.
Sure.
Is it safe to exercise when you're going through kidney failure?
Absolutely. You know, and in terms of kidney failure, really it's across the spectrum. So, you know, if you have chronic kidney disease, so you're not on dialysis, absolutely, you can do your exercise. I think the main thing is to really keep yourself hydrated. That's really important, just because that can really put your kidneys into a bit of a crisis if you dehydrate yourself. If you're on dialysis, it is still very safe and it's encouraged. You know, you want to maintain that muscle mass. You want to, you know, get the healthy benefits that come from the exercise. Now, obviously, it depends on the type of dialysis you're doing. Peritoneal dialysis and hemodialysis have different types of accesses. So that's something that's not my area of expertise, but I know, for example, in the hemodialysis unit, we're very fortunate to have a physiotherapist that will come and work with patients while they're on the machine dialyzing. They bring the bike and they have a program for them, and they slowly work up their capacity to be on the bike. They do weights, and they also guide them for when they're at home and do things safely where they're not going to damage either their fistula or where their line is. Similar to PD, the patients will reach out and you could, as a team, usually it's the doctor will give some basic guidance, and then obviously physio, they're the experts, and they can kind of give you some guidance in terms of how to safely do exercise without damaging or putting pressure on the catheter. So I think it's really important for patients to continue that and just, feel healthy and feel good and do what they can. And Jennen, I know yourself, you were very much an exercise buff. I know that you enjoyed that and really worked hard to maintain that. In terms of after transplant, Linda, is there any, I know that patients are also encouraged to exercise, but any other tips from a transplant perspective?
So from a transplant perspective, immediately post-transplant, we don't recommend you going for a jog or going for like some excruciating kind of long-term exercise regimen. We tend to recommend walking for the first 6 to 8 weeks, nothing that's really going to use your abdomen muscles. So patients have just gone through a major surgery. Even though the incision may have healed on the outside, there's still the incision on the inside that we need to heal. So typically, the general rule is about 6 to 8 weeks post-transplant before you can start using exercise that you're actually using your abdomen muscles again. However, I always encourage patients to speak to their transplant nephrologist or to their nurse practitioner, for example, just to make sure if there was any complications during surgery or any extended length of hospital stay, for example, which could also impact the incision, for example, if it may have gotten infected or whatnot. So what we tend to encourage is that walking is probably the best exercise to do. So I tend to tell patients to slowly build up a regimen to even walking an hour a couple times a week or something along those lines. More of a moderate pace as you kind of build up your strength, because it does help build that muscle mass. But however, we do kind of say around the 8-week mark, just ask your nephrologist to see your transplant nephrologist to see what the best regimen would be for you.
Okay. Linda, this is like a hot topic right now, the COVID vaccine. So in your opinion, do you feel that it's safe for someone who's going through kidney failure, or even someone like myself who has had a transplant? Would it be safe to get the COVID vaccine?
Yes, definitely. So we highly recommend both populations to receive the COVID vaccine. Recently in the news, you may have seen that actually coming out of Toronto General Hospital, there was a study, particularly with transplant patients, noting about the COVID vaccine, and that transplant patients or immunocompromised patients actually do need a booster. So as you know, the Ontario government has now allowed for vulnerable populations, including transplant patients, to receive a booster, because you may not, because of the medications, you're not able to build up that immunity as well as the general population, for example. So unfortunately, COVID, we don't know the true long-term side effects of it. And we have this wonderful benefit of having a vaccine. And there's been many trials, and I know there's lots of misconceptions out there about the trials and things like that and how they came out so quickly with the vaccine, but it's just because they were able to, and it went through rigorous testing and things like that. So I would definitely recommend it for both populations.
Okay. Now this question to the both of you. Do you feel that it's possible to slow down kidney failure? Is that something that's actually possible in today's day and age?
I can jump on this, Linda, if you'd like. I think there's a number of strategies that in many cases, I mean, you do have situations, some patients, their type of kidney failure, it's maybe genetic driven, or, there's other factors that are in place. But in many cases, there's a lot of strategies that can help support your kidney health and protect your remaining kidney function. So I know, it's really encouraged to lead a healthy lifestyle, which we just talked about, as well as manage the other medical conditions that you have. So, for example, with a healthy lifestyle, don't smoke. It really can exacerbate high blood pressure. There's a lot of data around stopping the smoking to help protect, protect the kidney function. Include physical activity in your day-to-day routine. I think that's really important, because not only will it help you maintain a healthy weight, if you do have a little bit of excess weight that you're maybe wanting to lose, it can help you achieve that. And typically when you do, if you're overweight and you do see a little bit of weight loss, it does also help things like high blood pressure, or for example, if you have diabetes, it can help better control your blood sugars. And so, those two particular medical conditions, the diabetes and the hypertension, it's really important to keep those under control. I think, it's a combination of using medications, but also your own healthy eating and healthy lifestyle that can help mitigate, the numbers going up. When your blood sugars are running high or your blood pressure is running high, it really can cause damage to the filters in the kidney. That's been shown time and time again. And so, you have that opportunity to do something about that on your end. And so it may not completely stop the kidney damage from progressing, but it certainly can slow it down. And I think, the patients always feel a little bit out of control, like things are progressing, and, you feel that I don't know what else I can do. But at least with these variables, the eating healthy, losing weight if you're, needing to lose weight, not smoke, good blood sugar control, good blood pressure control. Those are all things that you have the control of as an individual to help do your part in just slowing things down, or, maintaining where your function is. Because not everybody progresses, right?
Mm-hmm. Mm-hmm. That's good to know.
Linda, have I missed anything, or
no,
anything to add?
I think you touched upon the comorbidities, which is the key. A lot of large things, because we, as dietitians, we tend to talk about the lower protein for sure, in terms of how the protein tends to exacerbate, or these higher protein diets, for example, can make your kidney work harder, and in the end can decline your kidney function. So, but actually touching upon that, and the comorbidities such as the diabetes and the blood pressure, for example, are also very key in terms of adding to helping preserve whatever kidney function there is.
That's good to know.
If you look at the data that they pull across Canada, diabetes is one of the number one leading causes of kidney failure.
Wow.
Yeah.
Okay. Myself personally, was lupus that started my kidney failure, but that's good to know though. I wasn't aware of that. Diabetes being the number one reason why this happens. Okay. Linda, so when I was going through my kidney failure, everybody came out, everybody had an opinion, everybody was a doctor. And so I had a whole bunch of suggestions. Do this fast, do that fast. You've got to cleanse, you've got to juice. Don't eat anything for 24 hours. And when you do, just drink hot water for another time. Everything came. So my question to you is any of this real? Like, that's just a fad, or is this real that you could actually just, drink, hot water for 24 hours and that will kickstart my kidneys, and hey, I won't need a transplant. Everything's good.
Jeannine, I really wish I could say yes. I wish I could, but I really can't. The only thing that I could tell you is that I guess one of the latest fads right now is the intermittent fasting diet. That a lot of patients, or a lot of general public, is actually going on board with this intermittent fasting, and there's a whole number of versions of it out there. But they did do a recent study with patients with polycystic kidney disease, so nothing specific to transplant or any other chronic kidney disease, but one was specific to polycystic kidney disease. And it did find that if you do an intermittent fasting, for example, 2 days of lower caloric intake or lower protein intake of 500 calories and protein intake around 20 grams, for example, and then the rest of the week you have a normal intake. Because within the week period, you actually have a lower caloric and protein intake, it did find that it helped preserve some kidney function. So, and also help with some weight loss. So these patients were a bit overweight as well. As Christine mentioned before, they may have had some other comorbidities. So they could have had things like diabetes or something along those lines, and some weight loss in conjunction with having less calories and also having less protein did help preserve some kidney function. So that's one of the things that was the only kind of study that's been recent that in terms of intermittent fasting. In terms of cleanses and things like that, I wouldn't recommend it. Because you're trying to maintain your hydration status as much as possible. And we don't know what the excess in terms of vitamins and nutrients and things like that. Well, any excess in vitamins, especially the water soluble ones, tend to make your kidney work harder, because the body only needs X amount of vitamin C per day, 75 milligrams, for example. If you go and take 1,000 milligrams of vitamin C because it's cold season, cold and flu season, and you continue that for 6 months, for example, the kidney has to work extra hard to get rid or basically make you pee out the extra vitamin C. So that's the scenario.
See, that's good to know.
We've had many patients. No, I was just going to say, we've had many patients over the years that, we see end up in the emerge because they've been trying a new concoction or, drinking tons of herbal tea that they're not really, you're not always sure of the components of some herbal teas. And I mean, some are perfectly fine, but, they're just, sometimes the fad diets are better left in the corner when it comes to kidneys.
Yes. Yeah. So the takeaway here is no, if you drink a lot of hot water, you're not going to kickstart your kidney. So that's non-existent. Good. I'm glad I got it from the professionals. That's good. I'm going to ask both of you this question. In terms of weight loss, we touched upon weight loss a few seconds ago, but in terms of weight loss, what would be something that should trigger the patient's mind and say, I should talk to my doctor about this. Am I losing too much weight? I look really skinny. Or is that just something they should expect? Just going through kidney failure, you will lose a lot of weight.
I think it depends on the patient and their symptoms. And so, typically when you see that type of weight loss, or at least for myself, when I see a patient dropping a lot of weight, it's usually when they're progressing to stage 5. So the end stage where the kidney is really struggling. And typically your body is really trying to have a bit of a defense mechanism to, prevent more toxins from building up in the blood. And so food, obviously, when it gets broken down, some of them will produce the toxins. And so your body, you start to feel nauseous. Some people will start vomiting, or they just simply have no desire to eat. And so that's when I usually see the weight rapidly drop off, because, the toxin levels are just starting to build in the body, and your body kind of repels food as a defense to prevent, further, making the situation more dire. I don't know, Linda, if you want to add to that from another perspective, but.
No, I tend to agree exactly what Christine said. So in terms of as the kidney function tends to decline, there's the buildup of the toxins in the blood, especially something called urea, which is probably a familiar term for a lot of patients undergoing kidney disease. You'll hear these values such as urea and creatinine, and those are kind of key markers that we tend to look at. And urea tends to cause something called uremic symptoms. So something similar to what Christine's mentioning, the loss of appetite, the taste changes, and overall the intake is just less. And so definitely speak to your healthcare professional or a renal dietitian. You probably will more than likely have a renal dietitian, especially closer to the end stage renal disease, end stage of the renal disease, who will follow you more closely and be able to, weight becomes one of our key markers and kind of giving us a red flag if something's happening nutritionally, for sure.
Okay. Now, in regards to post-transplant, Linda, I'll ask you this question. In terms of like fast food, like now that the person's had their transplant, everything feels great, is it safe to go ahead and eat that Big Mac or go ahead and, have that junk food in moderation?
So I'm going to say in moderation, yes. So I don't want to be every time I kind of went to go see a patient who just had a transplant, I'm considered more the happy dietitian, because I've spent most of my time with patients who unfortunately don't have a transplant and saying, okay, please don't eat these foods, and we're trying to keep you safe. And now I'm able to say, please eat these foods, so then that way you can keep your transplant as healthy as possible. So yes, Jennen, in moderation, it's fine. It's just that when it doesn't become in moderation, the medications, as you are aware, such as the prednisone, increases your appetite significantly. It also causes other comorbidities, such as the high cholesterol, for example. So having things like fast foods or more processed foods may increase your chances of exacerbating cholesterol levels, or also causing excessive weight gain, which can cause diabetes, for example. So just kind of keeping things in moderation. If it's a one-off or if it's a couple of times a month, for example, we try to work with the patient as much as possible to maintaining their overall nutrition, and we incorporate the whole grains and all the fiber foods. But if it's in moderation, we tend to say it's okay.
Excellent. That's good to know. I'm happy about that. Ladies, thank you very much for joining the show. You've been a fountain of information, greatly appreciated. And once again, you come back anytime, share your thoughts and opinions with us. And everyone that's watching, thank you very much for joining us here on the Brain Table Talk. Love to have you join us again. And remember, be the energy that you want to attract. Thank you very much. Take care.